Hi all, welcome back to my channel. I hope you guys are doing good. Today I'm going to discuss about stroke or brain attack or CVA, that is cerebrovascular accident. Let's move on to the topic. What do you mean by stroke? A stroke is a serious life-threatening medical condition that happens when the blood supply to the part of the brain is cut off. Let's talk about the types of stroke. The first one is ischemic stroke. Second one is hemorrhagic stroke. Third one is transient ischemic attack, that is TIA. The fourth one is brainstem stroke. And the last one is cryptogenic stroke. Let's talk about each type in detail. The first one is ischemic stroke. So here what happens? The blood supply to the brain stops due to a blood clot. You can see that in the picture. Due to a blood clot, the blood circulation to the brain stops. The second type is hemorrhagic stroke. So here what happens? A weakened blood vessel rupture and prevent blood flow to the brain. It may also lead to intracerebral hemorrhage and subarachnoid hemorrhage. So in the picture you can see some of the weakened blood vessel, it ruptures and it started to bleed. As a result, the blood flow to the brain stops. The third type is transient ischemic attack, TIA, which is also known as mini stroke, where the blood supply to the brain is temporarily interrupted due to temporary blood clot. So in the picture you can see due to some small temporary blood clots, the circulation to the brain stops for a short period of time. The fourth one is brainstem stroke. A brainstem stroke happens when the blood supply to the base of the brain is stopped. The last one is cryptogenic stroke. If the cause of a stroke cannot be determined, this is called a cryptogenic stroke. Let's discuss about the risk factor which leads to stroke. Hypertension, high cholesterol, some cardiac conditions like atrial fibrillation, diabetes, smoking, alcoholism, and sedentary lifestyle. Let's discuss about the symptoms of stroke. Here is an acronym to make it easy, that is B FAST. B stands for balance. So the person may experience loss of balance, headache, or dizziness. E stands for eyes. So they may have blurred vision. F stands for face. You can notice one side of the face is dropping. A stands for arm. So the person may have arm or leg weakness. S stands for speech. They will be having speech difficulty such as slurred speech. So if you notice these signs and symptoms, it's time to call for ambulance immediately. So T stands for time. Let's see about the symptoms of stroke in detail. So a stroke on the left side of the brain affects the right side of the body. A stroke on the right side of the brain affects the left side of the body. If the stroke occurs in the brainstem, it can affect both sides of the body. If the stroke affects the left side of the brain, The person may experience paralysis on right side of the body, sensory changes on right side of the body, speech and language problem, abstract thinking, problems with thinking and memory, slow, cautious behavioral change. If the stroke affects the right side of the brain, the person may experience paralysis on left side of the body, sensory changes on left side of the body, vision problems, spatial thinking or imagery, problems with thinking and memory, quick inquisitive behavioral style. If the stroke affects the brain stem, it can affect both sides of the body and could leave someone in a locked-in state. So, locked-in state is a condition in which the patient is unable to speak and cannot move except for vertical eye movements and blinking. They remain conscious, they can hear, think, reason, and comprehend. But the communication is established only through eye movements. Let's talk about the diagnosis. The main important thing is CT scan of brain, MRI scan of brain, blood test such as complete blood count and coagulation profile, which includes PT, that is prothrombin time, and PTT, that is partial thromboplastin time. Carotid ultrasound scan, echocardiography, and cerebral angiogram. When it comes to treatment, it depends on the type, affected part of the brain, and the cause of stroke. Let's see how to treat the ischemic stroke. So first one is thrombolytic drugs, that is tissue plasminogen activator, which is also known as TPA or alteplase. It needs to be administered within 3 to 4.5 hours of onset of the symptom. Let's have a quick look at alteplase and how to administer it. The recommended dose is 0.9 mg per kg. The total dose should not exceed 90 mg. 10% of the total dose to be administered as an IV bolus over 1 minute and the remaining as an IV infusion over 60 minutes. The second one is mechanical thrombectomy within 24 hours of the onset of symptom. Third one is surgery to remove plaque from the arteries. And medications can be started such as aspirin, clopidogrel, blood thinners, and statin to prevent further blood clots. Here we can discuss about the treatment for hemorrhagic stroke. So the first one is medication to reduce blood pressure, to prevent seizures and prevent blood vessel constriction, and also stent to support weakened artery walls. Surgery to repair the brain aneurysm by coiling or clipping. The last one is craniotomy to relieve pressure on the brain. They also need stroke rehabilitation, which includes speech therapy, physical therapy, occupational therapy, and cognitive therapy. Let's discuss about how to manage stroke. You have to remember 8 Ds. The first D stands for detection. That is, patient or bystander or emergency medical service recognition of stroke signs and symptoms. The second D stands for dispatch. So, emergency medical service activation and priority dispatch and response. The third D stands for delivery. Here, prompt triage and transport the patient to most appropriate stroke hospital. Here, pre-hospital notification is mandatory. The fourth D stands for DOOR, which means immediate emergency department triage to high acuity area. The fifth D stands for data, which includes prompt emergency department evaluation, activation of stroke team, lab studies, and brain imaging. The sixth D stands for decision, which includes diagnosis and determination of most appropriate therapy and discussion with patient and family about it. The seventh D stands for drugs, that is, administration of appropriate drugs or treatment or interventions. TPA, tissue plasminogen activator, must be given within 4.5 hours from the onset of symptoms. The door to drug should be less than 60 minutes. The eighth D stands for disposition, which means timely admission to stroke unit or ICU or transfer the patient wherever the facility is available. You all know the common phrase, time is brain in case of stroke, which means the time is of the essence when treating a stroke. There are certain barriers at the hospital which should be minimized. The first one is time to treatment area, time to physician assessment, time to CT. It should be less than 25 minutes. Time to CT interpretation. The main goal is the CT interpretation should be available within 45 minutes. Time for consultation, time for decision, time for consent, and time for preparation. The treatment must be given within 4.5 hours from the symptom onset. The door to drug should be less than 16 minutes. Thank you so much for watching this video. As you all know, stroke is a very important topic asked in many interviews, and also you can see a lot of stroke patients once you start to work in the hospital. It is very mandatory to know about stroke and the signs and symptoms, because stroke can affect anyone at any time. If you know the signs and symptoms, it will be helpful for you to identify on early basis and to treat it promptly. I hope this would be helpful for you guys. If you feel the same, kindly like, share this to our friends and subscribe my channel. My channel name is Jebin Shine, and don't forget to press the bell icon button so that you will get the notifications whenever I am uploading new videos. Thank you all. See you all again with one more interesting topic. Until then, it's bye from Jebin. Bye bye. Take care.